Welcome back to Vital Signs. We are here with Dr. Rao, and I want to remind you that anything you hear on the show is not medical advice. We are here to educate, and we are here to move forward in our health journey. But if you seek to change anything, please consult your practitioner. Without further ado, before the break, we were talking a bit about what's different between direct primary care and the insurance model. We talked a little bit about how Dr. Rao is truly increasing access. She encourages the relationship building with her patients and for them to reach out no matter what. And I want to kind of start there because Dr. Rao, I know that you are very passionate about wellness and early detection and preventing the disease to begin with. So how does that look from a patient standpoint?
Most of my patients, when they first join the practice, I have a 1 hour session going over their health and how to contact me in case they need me urgently. So most of those conversations are, bring about thoughts of strep throat, UTI, when, hey, I need the doctor, I need medications. But a whole lot of work goes in to keep the patients healthy. And I spend a good amount of time talking to patients. Say if they say like, hey, I'm fine, I don't need anything, I'm here just to make my first appointment. Then I start the questions, asking questions about how do you sleep, how's your energy, do you experience fatigue in the day, and how's your diet. So these are some of the building blocks of wellness which I start the conversation with the patient, which is not a general practice in the regular insurance model primary care. Again, time related, right? So they don't have the time to bring this about. They're just assuming you're sick and we treat you, we send you out.
Yeah, so you're taking the time with your patients and you're able to get to know them and you're getting to know their routines. And I know you work with very busy professionals and entrepreneurs who we don't get sleep. And actually, for the busy moms out there, like
Yes.
Sleep is something that we are chronically not sleeping well as a population.
Yes.
So what are some of the things that we can do, or do you have any tips for our viewers and listeners that they can start today that maybe will help them get better quality sleep?
Yes, sleep is one of my most favorite topics to talk about because it's the most ignored, it's pushed behind, and you accumulate something called the sleep debt. So once you accumulate the sleep debt, it starts affecting every part of your life and health. My favorite couple of tips is look at your end of the day and beginning of the day. Look at the time you're sleeping and getting up. So we call it like AM and PM bookends. How do you end the day and how do you start the day? And also sleep hygiene. And one of the most important parts of sleep hygiene for us, for our kids, and even for our parents in all generations is digital sunset. Switch off your devices, dim your lights, help your melatonin produce more, and you're going to sleep more naturally. And people with highly stressful jobs, with a lot of things running in their minds, adding a couple of stretches, especially your hip stretches and back stretches. Again, talk to your doctor if you can do these, or look up videos on, or look up advice from your physicians or physical therapists on how to do these. But I think it's important that everyone pays attention because there's a lot of stress stored in our body and we need to release that to attain good sleep. And having good sleep, you get a very productive next day, which is most valuable for busy people.
How do I know if I'm in a sleep debt?
So a lot of symptoms are anxiety is number one. You're always anxious, you don't know why, and people want a medication for that, but basically when we question those people that how do they sleep poorly. Anxiety is a very common problem. Overreaction, temper and mood disturbances is another common symptom that people experience with sleep debt.
And so if I'm irritable, if I'm having anxiety, and I know for a fact that I'm only getting 5 hours of sleep because I'm busy and I can't shut my brain down, if I start these practices, is my goal to get the same number of hours of sleep first, or to increase hours? What is the goal?
I guess the first step is to increase your quality and set the discipline, set up times when you want to go to bed, and make sure you're getting 7 to 8 hours of sleep. Second is quality sleep, and then a lot of people complain that I go to bed but I don't fall asleep. That's when the other practices come, as to clear your brain, write a journal, write a diary, or put your thoughts away in some way so that you're not carrying those thoughts to the bed.
And how do I know if I'm getting effective sleep? How do I, like, is there, say I've put all these things into practice and now I'm getting that 7 to 8 hours of sleep and now I'm getting quality sleep. How do I know that this is working for me and my body?
Well, it depends on your quality the next day, on how you perform, how the day went, and it's also self-reflection on what did I do right the previous day that this day was fantastic.
I love it. So whatever we did yesterday resulted in how I woke up today. And
Yes.
if I'm energetic, then obviously I did something right. If I woke up before the alarm, energetic, even better, correct?
Yes, and personally, as my life as a hospitalist, I learned, firsthand on what sleep deprivation does. And now I am equally obsessive about not losing my sleep and spoiling my routine. And I do that, and it makes a ton of difference. And I know when I sleep well, I'm having. So how do you have those perfect days? Is when your previous day ends well.
So the best day starts from the night before.
Exactly.
I love it. Foundations of success and of sleep is the foundations of health. And so over time, as we correct that, then we look at other things. And you have broken the barrier with your patients and made them comfortable with coming to you and saying, "Hey, I've got anxiety. What's happening?" And you can immediately go into how are you sleeping, and because you know them and you built that relationship. So one of the common things that we see in medicine is, I don't want to go to the doctor. And we see this everywhere. Don't get me wrong, I was a physical therapist for 20 years and there would be a sports injury. No, Jen, I don't need to go to the PT. I don't need to go to the doctor. It's going to heal on its own. Okay, you tore your ACL. It's not going to heal on its own. Like whatever that is. But that is a common thing that comes up.
Yes.
How do you overcome that fear of the physician or going to the doctor's office?
Yes, so it's a common reaction, and I think the reaction comes from two sides or two aspects of how difficult it is to approach a doctor, and once you get into that entanglement, it's very difficult to get things done or understand what's happening to you. The second one, and the other one is that you go there, you're given a medicine, you're sent out. Maybe they have that, the hesitation that I'm not able to talk to anyone there. The doctor's in for 2 minutes. I don't know who that person is. And they expect me to tell everything, and share everything. And another aspect is the financial burden, that once you start something like this, it gets more expensive and it gets more problematic. But we broke it down with the direct primary care. You have access, right? You don't have any wait time. We know time is very essential for everyone. We don't want to waste your time. We can do Zoom calls. A lot of times for my patients, if it's just a follow-up, if it's a lab discussion, if it's something that I need to talk about as a follow-up, I tell them, hey, we can have an hour's virtual discussion, but you don't have to come in if you're busy. That's one thing. It makes it easy. And the other one is financial transparency, that they know that they're not going to get surprise bills from me or from my office, or we don't bill the insurance and they get a surprise bill from the insurance. So that's ease of, that's kind of assuring the patient that we're not, just because of walking in the office, we're not going to charge you a ton of money. And another one is the relationship. I think it's very important that they're given a chance to develop a good relationship with their primary care doctor. That eases their burden of like, okay, I can call her anytime, I can text her anytime, and she's going to be there helping me and not charging me for every call and text I make.
And on top of that, when we have something wrong that's hard for us to bring up, I mean, I'm just going to use change of life. I mean, I'm in perimenopause. Like when we go through our changes in life, there's things that happen, whether we're in our teens and having hormonal changes or we're passing into our elder years. And those are difficult for a lot of people to bring up to their physicians. And I think it's because we don't have that relationship. So do you find that people will bring the more concerning or the things that they don't feel comfortable speaking about to you now that you've built that relationship? Has that broken that barrier down?
Yes. I get a sense, like once I know the patient for a while, I get to hear these issues. They talk about females and males, right? So energy is a big issue, and everything ties up to energy ultimately, and again, sleep ties up to energy. So energy and versus fatigue is a very common symptom, and it affects us in the worst ways. It's like, be it a mom with 3 to 4 children, it goes crazy, right? And then half day along, they lose their energy, they don't want to do anything, and then they're suffering through the rest of the evening. That's just a short example, but yes, it's that's something we can sit down and talk about it. So what is the reason? It could be just female hormones, it could be thyroid, it could be something very simple that we could fix and take care of further problems down the road. We know that energy issues lead to poor diet choices, and poor sleep. So by adjusting your energy, you can make them have a better, they motivate them to have better choices with the other stuff.
I love it. So we're talking about energy management. I talk about energy management
I
all
love
the time
energy.
as an entrepreneur too. People talk about time management. It really isn't time management. It's energy management.
Yeah, and energy fatigue, and I almost love it when a patient brings it up that I feel so exhausted. It's like, I love it. We can do so much with it because it's not one of those diagnoses. There's abundance of options and methods to improve one's energy, and it varies, right? Men have different aspects that's affecting their lives. Females have different aspects, and I think it's one of the most common problems that come up when I'm discussing, medical issues with patients.
And I can tell you, in the primary, in a traditional model, I've never had time to talk about energy management like at all. I'm not going to age myself and tell anyone how old I am. But thank you so much for all of this wisdom. You've given us some tips for that sunset, the digital sunset, so we can get better sleep. How can people reach out to you if they'd like to learn more about your practice? If they're here in the Houston metro area and would like to visit you, how can they reach out?
They can look at our website at www.springsmd.com. Phone number is 281-826-1359. We are on all the social media platforms. Give us a call, text, email us. Happy to answer any questions.
Thank you so much. And we will be right back after these messages.